afternoon, everybody. So good you could all join in for this presentation and a sort of question and answer session. So I think we wanted to mainly discuss a little more about the Implant Master Program at Rajan Dental. And then if any of you have questions or specific issues, please raise it up by putting a question in the chat box, and I will look at it and answer it. I think the first question as the program started from Dr. Monisha. Yeah, I think Monisha, you're already on there, so we have started. Karna, can you hear me clearly? He's muted. Karna, you need to unmute and tell me. Okay, so you can hear me clearly. All right, I think most of you would have read the brochures that we sent out. It's got quite a lot of details. I'm just going to run you through. I think most of you have got the brochure with you. And the highlights are, this is a very intense, very clinically oriented program. You know, my team and I have been conducting many implant courses, right from basic to advanced, single tooth, multiple teeth implants, full arch, sinus lift courses, bone graft, and advanced courses like zygoma implant courses. But what we are presenting now in the first part of the Implant Master Program is a basic course which will cover all aspects of single tooth replacement and multiple teeth replacement, bridge situations. We will not cover full arch because that is in itself a separate subject. And unless most of you get experience in single tooth and multiple teeth implants and bridge placements, restoring them prosthetically, either as a cemented bridge or a screw retained bridge, I don't think you should start full arch. So that's the basic principle that we have, that you start with single tooth and multiple teeth implant placements, get comfortable and familiar with it, and then go on to the next module. So this Implant Master Program essentially deals with single and multiple teeth implant placement and replacement. This is targeted mainly at young practitioners or recently graduated students who would like to have a full-fledged theoretical, laboratory, and clinical exposure to implant treatment of patients. We have designed most of the theoretical component as an online content, and we will be having presentations by faculty led by me twice a week for 1 hour. We usually keep it on a Tuesday and Friday in the afternoon session between 2:30 and 3:30. So these will be presentations, and then we will give you a reading material and reference list. And then you do a little bit of home reading. And we will emphasize the clinical and practical aspects of implantology. So the program is for 6 months. And every 2 months, you will come to our center for 2 days, which will be like a refresher program for you to clarify any of your questions. And then you will have a practical dummy hands-on model session for surgery and prosthetics. And then you will get to place implants. You'll get to place 4 implants on patients under our supervision, and also restoring them. You will take impressions and do restorations, usually screw retained bridge and screw retained crowns. In these sessions, you will do the planning part, because that is very crucial for implant surgery. You need to do the planning with the prosthesis in mind, the final prosthesis, and then work backwards towards a surgical stent and diagnostics, which can be including cone beam CT. So you will get an exposure, you will see everything that's being done, you will see the CBCT in our center, you will do the implant, you will do the measurements and impressions. Of course, all of this will be preceded by demonstration by our faculty. We have 2 surgeons, 3 prosthodontists, 1 periodontist, and a maxillofacial radiologist in our team. So you will get lectures on different topics by them. You will have a chance to clarify any of your doubts when you come here for a hands-on session. You will also be able to visit the dental lab that we have in our own premises and see the steps from the time of taking an impression up to doing the final processes. So you will have an access to see all these happening live. And the advantages in between, like for example, you've done the first 2 months, you've come for the clinical session, you've placed 1 or 2 implants under our supervision on patients. The patients will be provided by us. So once you've finished this and you've gone back to your practice, if you're an early practitioner, if you're just, you can actually do 1 or 2 implants in your own clinic. So you get the feel of everything. When you come back, you can clarify doubts with us. So it's a very good way of learning. You have some lectures. You have exposure to practical sessions. You're doing patients under clinical supervision of us, of our faculty. You go back to your practice and do some patients on your own. And when you come back, if you have some difficulties or if you've got some doubts, it's nice to clarify when you come back. So that's why this module-based breakup is very good for people who want to learn the practical aspects of implantology. So there are doctors who are already into practice, but they're not comfortable with the surgical part of the implant. Some of them do place implants, but they're not comfortable with the prosthetic part of the implant. So all this can be addressed in this program. We will be essentially dealing for the clinical purposes with 1 implant system, but you are free to practice whatever system you want in your own practice because the fundamentals remain the same. Just the components and the drill kit, the surgical kit, prosthetic kit will vary from implant to implant system, so you're most welcome to practice whatever system you're comfortable with. Or if you're already practicing a system, you can continue to do the same. So we are going to commence this program on 16th November. And our program is now also recognized by the International College of Oral Implantologists. And there are only 2 such centers recognized in India. So part of this program, you will also get a certification for 1 year from the International College of Oral Implantologists. So you'll get a membership certificate as part of this program. Dr. Bopanna has mentioned not audible. I think others are okay. So you need to check in your side, Dr. Bopanna. Can you hear me now or not yet? Okay, we'll continue. I'm just going to put a few slides.
No. பிரகாஷ் என்னாச்சு?
Okay, Ajay, you can hear me. Dr. Suganya has a question. How will we get the certificate, doc? Suganya, are you talking about the ICOI certificate or our own? At the end of the program, you will get two certificates. One is from Rajan Dental Institute, that you have completed this Implant Master Program for single and multiple teeth implants. You will also get a certificate from the ICOI, a membership certificate, which will be certified through our institution. And that will be valid for a year. And then subsequently, you will have to renew it on your own. Or some of you want to proceed to a fellowship. There are some steps to do that. We will tell you about that in future. So if any of you have any specific questions, please type into the chat box. So you can see this screen, which has the international private courses in the ICOI. You can also go to the ICOI website and check. So these are the two centers that we have, the Cochin Implant Center and Rajan Dental Institute. So you can see the screens now. So we are one of the recognized centers across the world for international private courses for the ICOI. So this is the first batch of students that we are going to finish next month. And these are some of the clinical practical modules that they go through. And we also have a video testimonial from one of our first batch participants.
I'm Dr. Rajan. I have my private own clinic practice in Nepal. And I came here to know more about dental. I'm Dr. Rajan. I have my private own clinic practice in Nepal. And I came here to know more about dental implants. And most impressive thing in here is like Dr. Gunaseelan sir speaking was too good, and the way he explains about implants, it's like too good and it's very understandable. Dr. The Rajan Dental Institute implant was particularly practical session the second day. Module 1, Module 2, Module 3, Module 3. First module practical session. Actually, the implant some practice implant idea consultant but அதுக்கப்புறம் எனக்கு ஒரு இன்ட்ரெஸ்ட் வந்து நான் சார் அப்ரோச் பண்ணி இம்ப்ளான்ட் இது மாதிரி கற்றுக்கணும் ஐ ஹவ் டு லேர்ன் அப்படின்னு சொல்லிட்டு அவங்க இந்த ஆப்ஷன் கொடுத்தாங்க. பட் நான் உள்ள வந்ததுக்கப்புறம் ஃபர்ஸ்ட் ஆன்லைன் கோர்ஸ் வந்துச்சு, அதில் தியரி பார்ட்லாம் கவர் பண்ணாங்க, அது நல்லாவே எக்ஸ்பிளைன் பண்ணாங்க, நல்லா அண்டர்ஸ்டாண்டிங்காக வந்துச்சு. அதாவது நிறைய விஷயம் நம்ம கற்றுக்கிற மாதிரி இருந்துச்சு. அதாவது நிறைய விஷயம் நம்ம பயப்படும், பேனிக் சிச்சுவேஷன் இம்ப்ளான்ட்னாலே ஒரு பேனிக் தான். நாளைக்கு டெய்லி ஆச்சுன்னா என்ன பண்ணுறது, பேஷண்ட் பதில் சொல்லணும். காஸ்ட்டும் பார்த்தீங்கன்னா நம்ம இன்வெஸ்ட்மெண்ட்டு கூட ஒரு இம்ப்ளான்ட் பெரிய இருக்கிறனால நீ ஹேவ் டு ஸ்பெண்ட் மணி. ஸோ அந்த ஆஸ்பெக்ட்ல பார்க்கும்போது ஒரு பெரிய ஒரு பயம் இருந்துச்சு. பட் இங்கே வந்ததுக்கப்புறம் ஃபர்ஸ்ட் டே சார் அவங்க அந்த ப்ராக்டிஸ் செஷன்ல நல்ல ஒரு கான்ஃபிடென்ட், குட் எக்ஸ்பிளனேஷன்.
Presentation. So basically, Rajalakshmi is one of a fresh graduate. She's finished dentistry recently, and she's just going to start a practice. So she wanted to get a feel of implantology, because implantology and endodontics, coronal bridge are going to be the bread and butter of your practice. So the earlier you get into it and more you understand it, the better it will be for practitioners. Dr. Tirumurugan is a well-established practitioner from Trichy, more than 15 years into practice, and he used to call consultants for placing implants and restoring them. So now he has realized that he also needs to know more so that he can talk to patients and plan it with patients and follow up. See, every time a patient comes for a follow-up, you can't keep calling consultants again and again. So he's realized that that's very important, and that's the reason he came to start the implant program. And we have also got 3 postgraduate MDS students, and also MDS qualified doctors in different specialties like endodontics and orthodontics who are doing our program. But let me make it very clear that this is a basic program, a fundamental program. You will not get to see full arch. You will not get to see advanced grafting procedures such as sinus lift, etc. What you will learn is the fundamentals of implantology and to place single implants and multiple implant situations and restore them. And of course, you will learn how to plan adequately. If you well plan any procedure well, there's a saying that a procedure well begun is almost 50% done. So that's very important, the treatment planning part of it. So you will get a lot of that, and then we will teach you about in troubleshooting, etc. Okay, I'm going to take some more questions now. Dr. Sundari is asking whether to start your implant practice, what do you recommend, to buy a physio dispenser on own or to rent? Okay, that's a good question, because a lot of implant companies today offer these services. They give a kit on hire. They bring the implants, they bring the kit. They also sometimes bring a physio dispenser and an implant micromotor. So obviously, this is a good way to start with. If you're starting the first one or two cases, you don't have to invest all this all at this time itself. But as your implant practice picks up, I would say if you start doing more than 2 implants a month, it's worthwhile investing in a physio dispenser, in your implant micromotor, in your implant handpiece, and a kit. But at the beginning, you can certainly hire it from one of the implant companies. Gayatri wants to know, you come to a center every 2 months. Until then, will you have classes only through online? That's right, Gayatri. You will get online classes and presentations and videos, and only come to our center 2 days every 2 months. This is largely to make it more convenient for people and to also reduce the impact, especially for practitioners leaving the practice and coming. Third, of course, this was necessitated by COVID. Until then, we were having full-time courses, 6 months, 1 year, full-time fellowship. But this, the pandemic necessitated us to relook at things, and that's what we have started now. All the content of theory can be given online. And of course, we also have tests in between, MCQ tests. So it is important that you keep abreast of whatever we are teaching and asking you to read. And but like I said, this will be very, very practically focused. Okay, Monisha wants to know, theory classes alone, or can we join a package of 6 months course because I'll be pursuing my PG later? Okay, as of now, we have not thought of this option, but let me get back to you specifically. I'll ask Mr. Karunanidhi, who's coordinating with you, who's our CEO. I will see if we can let you participate only for the theory classes and not come for the on-site, because you feel you're going to pursue your PG later, so why do it 2 times? I think we should be able to help you. Although we do not have that option as of now, let Mr. Karnani get in touch with you, and if it's possible, then what will be the commercials, let him discuss with you. And the on-site program will be limited to only 4 to 5 students for the clinical sessions, so that it'll be the student and mentor ratio is almost like 2:1. So you'll have very personalized attention from the surgical staff, the prosthodontist, and then of course you will see the practical steps in the laboratory also. So you get a really good hands-on, and you will get exposure to the best clinical practices, consent forms, newer equipments, newer materials, newer implant systems. We practice almost 8 different implant systems. But you, of course, like I said, your exposure will be to 1 or 2 systems so that later on you can pursue that, or you can pursue any system of your choice. Okay, somebody wants to know, if I'm not able to join any of the on-site class, can I join later with the other batch? So what we have done is the online class twice a week is a live session, so that at the end of the class, you can immediately interact with the faculty with a question answer session. That's the advantage of this session live online with the faculty. But the same thing will be recorded and played again later in the night, usually late night. I think they do it after 9 p.m. so that you have a chance to look at it again. But at that time, you will not have an interaction with the faculty. That's the only disadvantage. But you can still see the recorded presentation later. Okay, Divya wants to know if there's any possibility of starting a full-time diploma classes. Honestly, we don't know when a situation is going to come back to normal. When a situation comes back to normal, we will certainly be starting a full-time fellowship program also, which is a 1-year full-time fellowship where you'll be with us. And that will, of course, be restricted to only 6 students per batch, which is what we were running earlier. 6 students per batch, and you will be full-time. So you will do all the lectures, classes here. You will observe a lot of work done by our implantologists. You will see long-term follow-up of patients, maintenance issues. You will see complications and how to deal with it. So we can't start now till we get over this pandemic. I think we're looking at least next 6 months before we can start a full-time fellowship or a full-time diploma class. It's 1:30. Any more pressing questions or doubts?
Doctor, this is Karunanidhi.
Yes, Karna.
Yeah, this online practical, I request you to brief one more time, on the practical, what exactly they will do and how they will be provided the opportunity and, how we will facilitate the assistance for them with the confidence. There's planning for implant using CDCT or OPG. That I request that part also to be covered one more time, sir.
Sure.
A lot of people are having doubts on that.
Okay. Before that, Ajay Kumaran has a question. Is iFix implant pattern similar to other brands? iFix implant design is taken from, I think, 2 or 3 international brand designs. I mean, it's a threaded implant. They have also come out with the bicortical implant recently. And they have had studies done in Maulana Azad Institute of Dental Sciences in Delhi for over 2 years, over 400 patients, and very good results. So the design is a screw-type implant, very closely resembling Alpha Bio and Nobel Active design. I mean, that's the closest I can compare it with. And a very good design and very good surface characteristics. So, and it's worked very well with us for more than a year. So we are very happy with it and very cost effective. So that's a huge advantage as far as iFix or an Indian implant system is concerned. But of course, like I said, you will get also to, the fundamentals are the same for any implant system. The science behind osseointegration, the science behind occlusion, your biomechanics are all the same for all implant systems and designs. Of course, newer designs allow you to load faster, placing an implant and loading immediately. Some systems allow you. Some systems allow you to load only after 3 or 6 months. Some designs allow you to load it within 1.5 months. And of course, full arch, we load immediately. So those are newer designs and newer surfaces and coatings, which we will discuss with you during the program. Mr. Karunanidhi wanted me to brief you more about the practical session, because I think a lot of them have asked him doubts. So essentially, when you come for the clinical sessions, you will be presented with a patient with all the records beforehand. Like the patient will have a cone beam CT, they'll have a study cast, they'll have the medical history ready, and you will have to then do the planning yourself. We'll give you about an hour to do the planning, and we'll give you software, the system to do the planning on a cone beam CT. And once you plan it, you will present it to our faculty. And once they accept it, you will be given a chance to do the surgical stent. So on day 2, you will do the procedure on the patient using the stent that you have done. You will see the patient, you will give the block or local anesthetic, and you will raise the flap, you will place that implant. If there's any problems, we will help you with it. One of you, if we get 4 participants to the on-site program, when you are doing a patient, one of the participants will be assisting you. So basically, they will observe and learn firsthand how it is done. And when the participant number 2 is doing his or her patient, participant number 1 will be assisting. So you get to do a patient, you will get to assist a patient firsthand. So you will really see different situations and how it can be handled. A lot of times you may not have enough bone. You may have to do a little bit of minor bone grafting. We will allow you to do it. We will give you materials for the grafting, because this is a very, very practical situation. We don't want to give you ideal cases where there is enough bone, everything is normal. It doesn't happen in your practice. In your practice, you will get patients who have slightly less bone, who have slightly reduced mouth opening, issues like that, medical issues. So you'll have to handle it in a real life situation. So we will be mimicking that as far as possible. So like I said, you will get to do the implant. And second stage, when you come, you will get to do an impression on those patients. You put the impression copings, you would take an impression. There are different techniques, closed mouth impression or open mouth impression techniques. So you will get to do all that. And mind you, all this is done under direct supervision of our faculty. So there'll be a lot of hand holding so that you get the confidence. Of course, if one of you is very confident and says, "Sir, I will do it on my own, you come and see it later," we are happy to let you do that. Ultimately, that's the idea. We want to hand hold you in the beginning and then let you go on your own, so that you become a very confident implant practitioner. Okay, one more question from Suji Felicita. Is this only a seminar session, or can we do practice also? If we can practice, how do we practice, either in model or in patients? Okay, Suji, I think what I discussed just now answers your question. You will get a model-based practical session for surgery and for prosthodontics, and you will get to do work on patients. So this is one thing very different in our approach, because my philosophy is that you learn properly, you learn to plan properly, but the proof of the pudding is in eating it. You will get to do implants under our supervision. Thereby, you'll get that confidence level. And when you do 4 implants, you can really get confident. And for those of you who want to do even more implants, you can speak to a manager, and then we can have some special sessions for you. But all of you will get to place 4 implants and restore 4 implants. So that's a big difference in our program. We are making it intensely practical so that it helps you in your practice. We are not focused largely on the research part or the innovation part. That is for a different group of people. We are not focusing on advanced procedures, like I said, block bone grafts, ridge splitting, sinus grafting. All that is not for now. You need to get to learn to practice basic conventional implantology. Once you do about 100 implants, then you're ready to do, the next advanced program, such as full arch or grafting procedures, etc. Karna, is that okay? You want anything more specifically? And one other thing I can vouch for is our team of doctors. Like I said, the surgeon, implantologists, etc., have enormous experience. In our practice, we have done, close to 8,000 implants of various systems. And we probably have the highest number of full arch cases in the country for zygoma implants. And we have many publications from our department. So all the faculty have handled more than few thousand implants. So that makes a big difference again. So it's not just relying on me as an individual. We are a very, very experienced and strong team with a large experience in implant practice and also implant education. A lot of them are senior teachers in colleges. Some of them have left the college and come into full-time practice in our practice. Many of them have been speakers for several implant brands. I have myself been a brand ambassador and speaker for Nobel Biocare and Straumann in a lot of international conferences. So we bring a lot of expertise to the table.
Doctors, this is Karunanidhi. I request you to post any further questions you have. You have any clarifications about the course, or you want to know specifically any particular aspect of the course also, kindly post your question in the web message text box.
Okay, I've got one more question. I think I'll take that as the last question. Suji wants to know what is the duration of the program and how many days per week or month. Okay, Suji, I think you've not read the brochure. So I think the brochure says it all, but I will anyway reiterate. It is a 6-month program starting from November 16th, and you will have 2 sessions a week of 1 hour each of online classes. So usually on a Tuesday and a Friday, in the afternoon session, 1 hour of online theory classes, which will also have some clinical videos, etc. And every 2 months, you will come to Rajan Dental Institute for 2 days. And those 2 days, you will have exposure to doing model-based implant, doing surgical stent, doing implant placement for patients, taking impressions, making the processes, going to the dental lab to see what happens from the time of the impression to how they pour the cast and how they put the implant analogs and how they fabricate the processes. So you will get an idea from the beginning to end. Even the diagnostics part, you will see the type of radiographs we take. We have a CBCT machine in our practice. You will see how that is done and how helpful it is. We have got very advanced diagnostic modalities such as the ISQ machine. We have a graft material, the dentin grinder. So you will see almost all the materials, all the graft materials that is being used in contemporary practices worldwide. So you'll get an exposure to all that. Great, I think there are no more questions. So like Mr. Karunanidhi said, if you have any further questions, please feel free to write to us or to speak to me or to Mr. Karunanidhi. And I hope to see you all soon. Thank you. Bye-bye. Have a good day.